A couple of things about adenomyosis that we failed to tell you. So here it is. Adenomyosis are cells similar to the lining of the womb that grow in the muscular wall, and that leads to a bulky and stiffened uterus. Remember, our uterus, which is the womb, this bit, attached to our fallopian tubes and our ovaries, and also this is the cervix down here, and this is our vaginal canal. So the uterus is meant to be slightly mobile and it should have a bit of a dynamic movement, but as the adenomyosis grows in the muscular wall, it makes it bulky and stiffened. So in comparison, adenomyosis is sometimes termed the evil twin of endometriosis, which are cells similar to the lining of the womb that go out and about into the pelvis, causing adhesions and scar tissue that can be extremely painful. So adenomyosis is a progressive disease just like endometriosis. So in its early stages, it can get missed and it goes from stage 1 to stage 4, just like we have with endometriosis. Adenomyosis is rather a sneaky condition. Not only is it missed, but it appears in different ways. You can get focal, so you can get focal lesions in the muscular wall. You can get diffuse, so it's scattered around diffusely in and around the muscular wall, or you can get an adenomyoma. Now, adenomyoma of endometriosis is quite sneaky even further because adenomyoma tissue has the ability to produce its own level of estrogen, leading to an area of local hyperestrogenism. And in that affected area, what happens is that the adenomyotic tissue contains the necessary enzymes such as aromatase and receptors, which convert androgens into estrogen, which means it fuels its growth. So basically, it is able to self-sustain itself by producing its own level of estrogen. The symptoms of adenomyosis is heavy, painful or irregular periods and bleeding with quite large clots, bigger than a 10p pence. You can get severe pelvic cramps or pains that are deep down into the abdomen, and they get worse over time. And you can get pain during or after sex. Other signs that you can get with adenomyosis is feeling full or bloated, like this full feeling abdomen, almost like that you look pregnant but you're not pregnant. And you can have a larger uterus, which can sometimes be felt just by feeling your tummy because it's becoming bulky and hard. You can also get constipation, urinary frequency, and also leg pains as well because of the pressure of the uterus pressing down on the arteries and the veins in the abdomen. Pregnancy and menopause does not cure adenomyosis. So even with your period stopping, the condition sadly progresses and it continues to cause symptoms. We know that adenomyosis is a hormone-dependent condition, meaning its growth is promoted by estrogen. So by stopping estrogen, all it does is it just controls the symptoms, but it does not cure it. So in the menopause, yeah, it doesn't go away, it will still be there and can continue to cause those symptoms. Now, having a hysterectomy, so a hysterectomy is the removal of your womb, so far is seen as a cure, and I say that with air quotation marks, of the adenomyosis. But we don't know, because it's the evil twin of endometriosis, whether they come together or not. I hope that's been helpful. If there's any questions, please leave them down below.